found on DallasRenalGroup.com or on the Dallas Renal Group Facebook page. This is Dr. Vik Prakash, and I'm co-hosting today's show with Dr. Parin Makadia. We are live in studio with Dr. Robert Duhaney discussing nutrition and diabetes. The number to the studio is 972-235-5555. Be a part of the conversation, call us, and ask our expert. We did take a couple calls during the break. One of our callers was a registered dietitian who had a comment and a question. She said that she sees a lot of diabetic patients in her clinic, and a lot of them have prediabetes and tend to put it on the back burner and not pay much attention to it. But when they're formally diagnosed with diabetes, their doctors are quite aggressive in the treatment and addressing their nutrition. So her comment was, why are we not stressing it more in the pre-diabetic phase to prevent them from getting full-blown diabetes? Dr. Duhaney, if you could comment on that.
Yeah, I think that's an excellent question, and that is something that I'm seeing more of, and even watching it in myself, because I'm going to my primary care doctor and we're kind of watching the numbers. So one way you know you're pre-diabetic is looking at the same lab indicator for diabetes. It's called a hemoglobin A1C, and so based on that's a measure of how sticky the blood is, if you will, kind of an average over 3 months of how much average sugar is in the blood. And so they've figured out that, and this varies from who you look at in terms of the resource, but around 6.0 to 6.5 is kind of that true pre-diabetic state. And so if I see my patients kind of drifting into the 6.0 to 6.5 range, we're having conversations about weight loss and diet and how to prevent them from becoming full-blown diabetic, which is over that 6.5 kind of indicator. Most people who are diabetic, they know the 7.0 is where they want to get below, but that's usually on medications and intensifying their diet and exercise. But the pre-diabetic, before that they get to that state, she's right. We need to do a better job as primary care physicians at educating our patients and not just saying, way to go, you're not diabetic, but wait a minute, you're getting close to that. Mm-hmm. How can we turn that around? And there is data to show that if we're aggressive in that phase, we can prevent diabetes, hold off diabetes for many years. And so that is just a great question, and I agree with that.
Let's take a live call. Hey, welcome to Doc Talk. What's your question?
Thank you for your question.
Oh, that's a great question. I'm not quite sure offhand, but I do know that salmon is a good source of omega-3s, the DHA, and there is actually other types of fatty acids that they're doing more research on that are being found to be very good for the lipid profiles and cholesterol, like EPA, which is related to DHA. They're both omega-3 fatty acids. Sardines, the thing that you need to watch for with that is they can be packed with a lot of salt. They're usually canned. And folks who have other issues like gout have to be careful of that because they have a high purine content, so they have to be on a low purine diet. So that may not be something that you'd want to eat a lot of if you have any of those issues going on. But definitely salmon is good. A lot of the cold water fish in general, cod, halibut, they're all very good.
Welcome to Doc Talk Live. Your questions for expert? So we're talking about diabetes mellitus for this topic. So please submit your question on our Doc Talk Live website, and we'll be happy to have one of our endocrinology experts answer that question for you.
Dr. Duhaney, we had another caller during the break that asked, what is the kind of ideal weight to maintain in order to prevent diabetes? So can you give us a clue on how to figure that out?
Yeah, that is a very challenging thing because that's also dependent on the person. So most people probably have heard of what's called a BMI, a body mass index, and that's really just taking your kind of your height and weight, putting that into an equation, and they come up with these graphs and tables to say this is about where you need to be. Typically for the average person, it should be between 19 and 25 is a normal BMI, but unfortunately we see numbers that are above 25 in that index, and oftentimes I feel like me as a primary care doctor looking at them, you don't seem like you're overweight, you don't seem like you have those extra pounds on, but looking at each individual and figuring out just again their background, their lifestyle, how they're eating, what other challenges that they may have is kind of the most important thing. The ideal weight, I'd say, would be, what I've seen is kind of in that 19 to maybe 27 for the BMI. We could conceivably push that up above that 25 cutoff. It's always been out there. Once you get about above 27, 28, you are kind of drifting more towards obesity, and you may not have issues with hypertension, high cholesterol, and diabetes, even as a BMI of 30 or greater, but we know the statistics don't lie, and that is definitely going to be putting them at higher risk.
Folks who are joining us, you're listening to Doc Talk Live. We have Dr. Duhaney in the studio with us discussing nutrition and diabetes mellitus. Number to the studio is 972-235-5555. Dr. Duhaney, let's talk about weight loss medication. Do you typically recommend any of the weight loss medications? And also, after medication, please tell us a little bit of tell us your thoughts on bariatric surgery.
Oh, those are good questions. Thank you so much, Parin. Yes, I do offer weight loss medications along with diet and exercise and treating the underlying issue such as diabetes. There are a number of different things on the market that have been out there for a while. One of them that's, I think, relatively easy to use is phentermine, or also known as Adipex. It is generic, and it can be generally well tolerated. The main issues with that could be just dry mouth, constipation, and just jitteriness, because it's a stimulant. But what it does is it actually suppresses the appetite, and it is very effective at weight loss. 1 to 2 pounds a week on average is what I've seen. The downside with that medication, other than if it can't be tolerated for the side effects, is just that it wears off. After about 2 to 3 months, you don't see the weight loss anymore, and you are recommended, FDA does recommend stopping the medications really only for a short term. So I use that to kind of buy some time with patients to try to see if that kind of allows us to give them an ability to lose weight through also dietary changes, making those adjustments as well as the medication.
Let's take a live call. Hey, you're on the air for Doc Talk. What's your question? Fantastic question. Dr. Duhaney?
That's a great question. Victoza is great for weight loss and diabetes. It's kind of hits both. And in fact, they actually took Victoza and nearly doubled the dose on that and came up with a medication called Saxenda, which actually is not for diabetes. It's just strictly for weight loss. But Victoza by itself is fabulous. Usually you're using that in conjunction with metformin, and that helps to suppress the appetite, and is very effective for blood sugar control. So yes, it's very good.
Let's take another caller. Hey, you're on Doc Talk. Hello? Yeah, go ahead. Hello? Yeah. Do you have a question? It's a fantastic question. Dr. Duhaney, can you explain?
I think I know who's asking the question. It sounds like my son Isaac. Thanks, Isaac. And that was not planned, ladies and gentlemen. Where does the sugar go in your body? Well, your body uses the sugar, glucose, for energy. Your brain needs it. Your brain takes up most of the metabolism of the body day and night. And so it needs that glucose to function. Now, it can run on other things like ketones, but during the day we tend to take in more carbohydrates, more glucose than we need, and it stores it up in the liver as a glycogen. And then at night it breaks it down into glucose that the brain needs when we're sleeping. This is actually how metformin actually works. One of the sites it works is in the liver to try to slow down that process of the glycogen breaking down into the glucose and going into the bloodstream, because diabetics don't need that extra glucose going into the bloodstream. So that's a great question.
Let's take another call. Hey, you're on Doc Talk. What's your question for our expert?
Yeah, well, this is Dr. Duhaney again. Thank you so much. Yes, I realized that I didn't get a chance to mention that. The side effects mostly tend to be nausea. Nausea is kind of the number one side effect with Victoza, because it's basically working to suppress your appetite and affect metabolism. That's one of the side effects that it has. On a very, very rare occasion, it could inflame the pancreas. But the number one side effect with Victoza tends to be nausea.
Well, all right. Dr. Duhaney, I have a 3, maybe 4-part question here. Are low carbs diet healthy, and can that diet help you lose weight? And if so, is the weight loss sustainable?
I'll answer that last part. It's usually not sustainable, or only sustainable as long as the person can maintain the diet, usually. I like low carb diets for folks who I call low carb sensitive. It's hard to do one diet for everybody, but there's some people, and they know who they are, where they just look at that donut and they gain 5 pounds. If that's you, you would be carb sensitive and probably would do well with a low carb diet, at least in the short term. It's hard to maintain those because carbs are all around us, and so to try to limit that on a long-term basis is very difficult. But what low carb diets do and how they work is they just force the body to use the fat, because usually in those diets you're increasing protein and fat, to burn the fat more efficiently and use that as energy, basically generating ketones for the body. And usually when you go into a ketonic state and you're not used to that, that cannot feel very good. You can be very fatigued and have headaches and that sort of thing. But the interesting thing is a lot of folks that are on low carb diets, like the Atkins diet and the South Beach diet, which is a little bit modified version of the Atkins diet, when they actually come off those diets and then they go back to, let's say, taking their regular vanilla latte from Starbucks, they go, oof, I don't like this. This is actually too sweet. It actually changes your taste buds over time, which is actually a good thing. It kind of alerts you to the fact that we're taking in too much sugar, too much salt, kind of what we said at the beginning of the program.
We have time for one more question. Welcome to Doc Talk Live. Your questions for expert. We apologize for that. We may be having... Yeah. Sure, and we apologize for the technical difficulties.
Yeah, so
we have about 10 seconds before we at the end of the show, but
yeah.
Sir, you're about to get cut off because we're about to hit end of the show. Please.
That's
Was
not
this
how we
Suresh?
end this show.